Making Medicare mistakes during the open enrollment season is a huge and very costly problem. I'm going to show you the 3 big mistakes and how you can avoid them. Now, the reason mistakes are so common during the open enrollment season is, number one, Medicare is just a confusing system as it is. And secondly, it's because of all the information that you're exposed to during the season. And some of that is misinformation and, frankly, misleading information. And thirdly, because everyone wants to share their opinion with you as to what you need to be doing with your Medicare. And so lots of confusion. But what I'm going to do is I want to focus on what I'm calling the 3 big mistakes. You need to avoid these because if you don't, it could cost you greatly. And so we want to make sure that you avoid these particular mistakes. Okay, so let's talk about these big 3 mistakes. Now, the first one has to do with the annual notice of change. Now, quick review. When someone goes on Medicare, they only have 2 options of using their Medicare benefits. They can stay in original Medicare A and B, where A and B pays first, but A and B has gaps, so people that choose this system to stay in original Medicare have a supplemental plan, one of 10 that are available to them. And then what happens is they have to add a prescription drug plan to their coverage. So in this scenario, we have A and B with a SUP to fill in the gaps and a separate drug plan for the prescriptions that I take on my own. The second option is to be enrolled in A and B, but what I'm going to do is replace A and B with what is called a C plan, or these are also called Advantage plans, all right? And so when a person is on Medicare, it's one or the other. A person can't be on both of these. So when we make our decisions, we're making a decision to be covered by one of these 2 systems. Now, let's talk about the annual notice of change. As we approach the open enrollment season, the insurance companies are obligated by October the 1st to let you know what they're going to be changing in the plan. Now, this notice has to do with standalone drug plans and all Advantage plans. Has nothing to do with supplemental plans because supplemental plans are written for life. So you're not going to get an annual notice of change on your supplemental plan. Now, you may get some price increases at your policy anniversary date, but again, that's not about annual notice of change at all because those are lifetime. So we're talking about these 2 plans here, are drug plans and Advantage plans, where by October 1, the insurance company is supposed to send you your notice as to what this plan is going to look like in the next year. And so this gives you a chance to know about what they're adding to the plan, what they may be taking away from the plan, what changes are going to occur. So when it comes to the drug plan annual notice of change, what you're looking for is you're going to see what will my drug plan premium be next year. Now, usually the premiums on drug plans are pretty stable, but sometimes we'll see a drastic price increase. I've actually seen them go up 30, 50%. Once we even saw a plan that tripled their premium. So you must open your annual notice of change. So what's the big danger? Well, sometimes people will assume that because they like the plan this year, they'll like it next year. Please don't assume that. Why? Because that drug plan can raise the premium. They actually can change the formulary. So you could have a medication that they're covering this year, but they're not going to cover next year. And unless you open your annual notice of change, you're not going to be aware of that until you go to get that prescription filled in January, and all of a sudden you find it's not covered. It's not in formulary. And why? Because you didn't open your annual notice of change. So open the annual notice of change, find out what's the premium. Are all my meds still going to be covered? Can I still go to the pharmacy of my choice? Because in every drug plan, you're going to have 2 types of pharmacies. You have preferred pharmacies and standard pharmacies. Every plan will usually identify maybe 2 or 3 different pharmacies that are preferred, and that means they're going to give you better pricing than standard. So you can usually go almost anywhere you want to as far as a pharmacy goes, but if it's not a preferred pharmacy and it's rather standard, then you're probably going to pay higher copays for your medications. So it's going to cost you more. So again, we're looking at the pharmacy choices, we're looking at formulary, we're looking at the premium. We want to make sure that our meds are covered. And then the last thing you're paying attention to on the annual notice of change for the drug plans is, have they re-tiered a medication? It may be in the formulary, but have they changed the tiering? Most plans have 5 tiers. The lower the tier, the lower the copay. 1, 2, 3, 4, 5. So as we increase in tiering, we increase copays. So you could have a medication that's covered this year as a tier 2, and the next year they rate it as a tier 4. You could be on a medication in tier 3, they rate it up to a tier 5. And so when we see a tiering change like that, a tiering increase, then that it could drastically affect affect your copayment. So if it's a tier 3 this year and you are have a $45 copay and they move that to a tier 5, that medication could cost you $150. I've seen jumps like that on a regular basis. So the point is, what you're going to do, look at the premium, make sure your medications are going to be covered. You can still go to the pharmacy that you choose for the best price, and that there have been any tiering changes for your medications. So that's the danger. You've got to read the annual notice of change. Now, the same thing is true when you have an Advantage plan. Advantage plans, like drug plans, are only written for 1 year at a time. So that Advantage company has the right to do anything they want with that plan. Sometimes they pull the plan. It's not even available into the next year. Or sometimes they can improve the plan and benefits, or they can decrease the plan benefits. So again, just because you like it this year, don't assume that you're going to like it next year, because things can change. They could add a deductible to the plan. They could change the copays. Maybe this year an MRI costs you $150. Next year it's going to cost $250. This year it may cost you $25 to see a specialist. Next year it's going to be $50, because Advantage plans are copays and co-insurance, and so you participate in the expense of most of your healthcare services. This year the hospital copay could be $300. Next year it's $400. So pay attention to that, and primarily what you want to look at is what we call the max out-of-pocket. Okay, the max out of pocket for the year, because every plan establishes an annual max out of pocket. So Advantage plans, you pay copay until you hit the max out of pocket, and that ranges anywhere from $3,000 to $4,000 on HMOs and upwards to maybe $5,000 or $7,000 on PPOs. And so you pay copays till you hit the max, and sometimes we can see that drastically increase. And here's what I want you to remember: the annual notice of change will let you know what that plan is going to look like the following year. So open up. And if you're happy with the plan after you looked at the annual notice of change, either it's Advantage or the drug plan, then you can stay on the plan, because what's going to happen is that plan is going to automatically renew. But when it automatically renews, we want it to renew because you took the time and you were diligent to make sure that plan is going to work for you the following year. And also, don't forget to make sure all your doctors and hospitals are going to be in the Advantage plan network as well, because that's also a big deal. Okay, so that is danger number one: not opening that annual notice of change, not knowing exactly what that plan is going to look like the next year. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. All right, that takes us now to the second danger that we see happening during this period of time, and that has to do with advertisements and agents. Now, what you're going to find as you watch advertisements, whether that's something you see on TV or it's in printed, coming to you in the mail or maybe online, and you see a website and some kind of advertisement, what you're going to find is that primarily all advertisements are about Advantage plans. It is very rare that you'll see a company advertise a supplemental plan or even a drug plan for that matter. So most ads are going to be all about Advantage plans. So what's the problem here? What's the fear behind this? Well, the problem is many times what an Advantage company will do is they will talk about all the benefits of the Advantage plan, but never any of the negatives or the disadvantages of that Advantage plan. They focus on the benefits. They tell you the things that you want to hear, and they rarely tell you the things that they don't want you to know. And so what happens is there's going to be fine print in all the Advantage plans. There's disclosures. There's things out there that they need to tell you about, but they rarely do, or they put it in the fine print. And so you can't just focus on the benefits that are talked about in the advertisements, because honestly, they make these plans look so great, and usually when something's too good to be true, it usually is. And the second thing they're going to do is not only just talk about the benefits, but they're going to talk about all the perks that come with that Advantage plan. Now, these perks are certainly legitimate, but you do not want to make a decision to get an Advantage plan just because of the perks. There's some freebies they throw in, maybe a gym membership that may reduce your Social Security benefit by $30 or $50. They will give you a vision allowance, hearing aid allowance, and all those are really nice things. But what they don't do is when they only talk about the perks, they don't exactly tell you how the insurance is going to work. So the whole point is you got to watch the advertisements, and sometimes they're very misleading because they'll advertise these plans and talk about all these perks, but sometimes those perks are you're not eligible for them. A lot of those perks and benefits for Advantage plans have to do with people that also qualify for Medicaid. Not always, but many times, meaning they'll talk about free transportation and meals and these different benefits. Well, you've got to be low income, low assets, qualified for Medicaid and Medicare before you're going to be able to get those benefits. So they kind of broad brush the plans as though everyone is going to be eligible to get money back on their Social Security check and get all these free items, when the reality is there's just a limited amount of people that are going to be able to get those. Okay, so you got to be careful of the ads. Now, what's very interesting right now, Medicare is beginning to crack down on these ads. Now, what's going to happen after January 1, 2023 is anytime an Advantage plan is going to do any kind of marketing, whether that's in printed form or on television, they have to go through a process that's a 45-day review to make sure they're not putting out any misleading information, to make sure consumers are not making a decision on this ad and buying a plan that doesn't even apply to them. Up until January 1, 2023, what's happened is Medicare allowed these advertising agencies and these Medicare Advantage companies to operate under a rule called file and use. So what they had to do is they had to file their marketing materials and sign off that they're compliant, but they were able to use those within 5 days. So they went live within 5 days, and Medicare had no time to really review to make sure that those ads were accurate. And so Medicare has caught these companies giving out misinformation and misleading information. And people call into these 800 numbers that are advertised, and they found that about 80% of the calls going in there, the agents were not honest about what those plans look like. And there was a lot of what they call churn and burn, very quick sales pitches, and not telling all the information, not checking every network and the medications. And so people were making decisions based upon advertisement. And so there was a lot of bait and switch that was occurring. And so Medicare's cracking down on that. No more can they make an advertisement and then show that within 5 days. They can't do that. They have to wait 45 days for Medicare to review it because Medicare's tired of all the complaints that are coming in from consumers who are misled by those advertisements. The second thing you have to watch for is agents. Okay. Now, again, there are some very fine agents in this business that will be very honest and very ethical. But here's what you're going to find during the open enrollment season. There are a lot of agents. This is all they want to talk about is Advantage plans. They don't want to talk about helping you get a supplemental plan or the right drug plan. Why? Because Advantage plans pay the agent more money. It's usually a quicker sale. It's an easier sale because of all the perks, but they don't tell exactly how the insurance is going to work. And so that agent gets a nice commission. But the question is that the best coverage for you? And again, sometimes it is, but sometimes it is not. So one of the dangers at this particular period of time are agents that will get in the business only from October 15th to December 7th, this 7-week period of time where they can get people to switch plans, and sometimes they'll say whatever it takes to get you to sign with them, and then you'll find out later what that insurance is going to look like. All right, and so there's a lot of pressure, and my view is this: when I find somebody that's pressuring me to make a decision, I know for sure they don't care about me, they care about themselves and their commission. And you want to deal with an agent that will be honest with you, that will tell you the ins and outs of all the plans, will share all your options with you to make sure that you're making an insurance decision that's in your best interest and not theirs. But there's agents out there that will push Advantage plans because there's a higher commission on those Advantage plans. All right, so the whole point is this: you want to make sure that when you go with a plan, it's going to be in your best interest. So don't fall prey to these pushy agents who put a lot of pressure on you to buy Advantage plans, or those advertisements that only tell part of the story instead of the complete story.
Hey, if you're looking for someone to help you hold your hand through this entire Medicare enrollment process, we would love to do that. Our team is standing by to help you. We help about 1,000 people a month go from Medicare confusion to having their plans enrolled, and it takes probably less than an hour. Go to the pinned comment below and you can book your appointment.
All right, that brings us to the third and really most important decision that you're going to make that you could mess up and make a huge mistake, and that would be switching from your supplemental plan to an Advantage plan. Now remember what we talked about. People can enroll in A and B. They get a supplemental plan to fill in the gaps, and we add a drug plan. That's one option of coverage. The other option is to do what is called an Advantage plan, and we've talked about these. These are the C plans. So what happens during this period of time with all the ads going on, there are people that are on supplemental plans that chose them because it was the best option for them, and then they start seeing all the ads and all the pushy agents, and then they decide, hey, I think I'm going to switch to that supplemental plan. And the reason I'm saying this is the biggest danger that you have is because if you buy an Advantage plan, what you need to be aware of is that that plan is going to work differently than your supplemental plan. Because once you enroll in an Advantage plan, number one, you are going to have a network of doctors. All Advantage plans are either going to be an HMO or a PPO. Okay, and with networks always come restrictions. Not every doctor is going to take the HMO. The PPO plan, there's more doctors in that, but certainly not all doctors are going to take that either. If you have that supplemental plan that you had for years, now what happens? You could go to any provider, any hospital, any doctor, any specialist that takes Medicare. They will take your supplemental plan. All right? And so what happens here, I almost had unlimited choices. They say that 99% of all doctors take original Medicare, and almost all hospitals take original Medicare. When you take a supplemental, but when you have an Advantage plan, it's not going to be like that. There's going to be less choices and less providers for you to get your health care. You've got to live with that. The other thing that's an issue here is when you have an HMO, you have to stay in your network. You can't go out of network unless it's urgent care or emergency situation. You're confined to that network. Now, the PPO lets you go out of the network, but when we go out of network, it's going to cost us more. If I stay in my PPO network, my max out of pocket for the year may be $4,000 or $5,000. But if I go out of network, it could be $7,000 to maybe $10,000 going out of network. So I have the privilege to do it, but again, it's going to cost me more. Here, again, we don't have a network. There is no in and out of network. If anyone takes Medicare, then they're in your network. You can go wherever you want to go. So my whole point is you've got to realize when you change from that supplemental plan to that Advantage plan, now you will have to live with networks. The second issue you have to be aware of when you make this switch that will not be talked about in ads or by agents, and that is this pre-authorization system. Now, a pre-authorization means that you need maybe an MRI or a CAT scan, possibly a surgery or an outpatient surgery, inpatient surgery, hip replacement, knee replacement, but you need something that's a little bit more on the more expensive side. And in order for you to get that service on that Advantage plan, it has to be pre-approved by the Advantage company. So the doctor says you need a knee replacement or a hip replacement, but you're not necessarily going to get it unless that Advantage plan agrees with that doctor and approves those services. And sometimes those services are delayed. Sometimes they're denied. I'm not saying they will always delay them or deny them. Sometimes they'll approve them immediately and they'll pay for it. But sometimes people are told, no, we're not going to give you that knee replacement. We want you to try steroid shots first. And after that, we want you to go to therapy. And then maybe we'll pay for the knee replacement. I've had that happen with hip replacements. Had a lady on an Advantage plan that needed a full hip replacement, but the Advantage plan would only agree to pay for a rod. They wouldn't pay for a full hip. That's all she got. Had a lady recently actually that needed a full hip replacement, and the Advantage plan said, no, we want you to go to 9 months of rehab first, and then we'll revisit the possibility of that hip replacement. And again, you have to live with that with Advantage plans. You didn't have that up here in the supplemental plans. Why? Because there are no pre-authorization. That supplemental company that you have, whether that's Aetna, United Healthcare, Mutual of Omaha, Humana, whoever you have on that supplemental plan, they have no pre-authorizations. They usually even put that right on your card. Why? Because if the doctor says you need it and Medicare says they'll cover it, end of story. That insurance company, that supplemental plan has no say-so whatsoever. If Medicare says they'll cover it, doctor says you need it, they're going to follow Medicare. So they have no decision power whatsoever when it comes to your healthcare services. So if you make that switch, now all of a sudden you have to live with pre-authorizations. Now I do want to let you know that you don't have to have a pre-authorization to see your primary care doctor or a specialist or to get preventive or maybe get some labs. For sure not. But they say about 70 to 72% of the services now needed on Advantage plans are going to have to be pre-approved. All right. And then lastly, and this is the big deal, and the big danger is this: it could be possible that if you make that switch to that Advantage plan, that it could be a permanent decision forever. Now, there are some intricate rules about this depending upon the states and insurance carriers, but by and large, if a person stays on an Advantage plan for any length of time more than a year, and sometimes less than a year, but if they're on a plan more than a year and they would like to be able to get off their Advantage plan and then switch back to here, now what happens to make the switch back to your supplemental company eligibility. Now you have to medically qualify. So if while you've been on this Advantage plan, your health has changed, and maybe you have an issue. Maybe now you have rheumatoid arthritis, or you become an insulin dependent diabetic that's having some neuropathy problems, retinopathy, or some health issue. Maybe you've had one AFib incident, spinal stenosis. So there's certain things out there, maybe a problem with the eyes, what macular degeneration, but there's things that happen with your health. And if you stay on that Advantage plan and now you want to move the supplemental plan, now you have to medically qualify. We'll ask you about 30 health questions. Check all the meds you're taking now and the meds you've taken for the last 24 months. And if that underwriter does not like your medications you're taking or have taken, or a health condition, maybe a pre-existing condition, that supplemental plan does not have to take you. They actually can deny you the coverage and say no to your application, and then you'll have to stay on that Advantage plan sometimes for the rest of your life. And that's why I'm saying, just because you see the ads and pushy agents talking about Advantage plans, make sure it's going to be a perfect fit for you, and you got to make sure you're going to be comfortable here. Yes, you'll save money on a monthly basis because most Advantage plans have no premium. You still pay Medicare, but they have no premium. Why is that? Because what? We pay as we go. If I have a supplemental plan, I'm basically prepaying. I'm going to pay a premium, and I'm pretty well done. Very little risk after that. Here, I may not pay a premium, but I'm going to take on copays until I hit my max for the year, anywhere from $3,000 to $5,000, $7,000 or $7,000 a year. So you're going to pay either system. Here, we pay a premium and we get rid of the risk, most of it. Here, we just take on the risk of whatever healthcare services that we're going to need. So you're changing systems when you move from that supplemental plan to the Advantage plan. And if you feel like that's in your best interest, then my view is let's find the very best Advantage plan that we can find that's in your market. But otherwise, you be sure to make sure you think through that change, because you're going into an entirely different system, one that was different from that supplemental plan. All right, so these are the three big dangers. Don't fall prey to ads and agents. Make sure you read your annual notice of change, and you make sure if you make this switch that is truly in your best interest, not just the interest of the agent.